Hello and welcome to US Healthcare. Those who are beginners, this video will help you understand it better. So let's learn about US healthcare system. But before we learn US healthcare system, it is very important to know what structure we use in India and how does it work. So in India, majority of the population simply go to the hospital, get treatment, pay the bill and come back. However, in US, it is different. Every US citizen is covered under healthcare policy. So when they take the treatment from the hospital, they doesn't pay hospital directly. Instead, hospitals send the bill to insurance company and insurance company pays on behalf of patient. Basically यहाँ insurance company से patient policy लेता है और patient के behalf पे insurance company payment करती है. So here three entities work: patient, hospital and insurance company. Patient who take policy from insurance company and pay them monthly, quarterly, half yearly or yearly. Hospital where patient take treatment and hospital send the bill to insurance company. And insurance company, it pays the bill on behalf of patient to hospital. Insurance company send payment detail to hospital and also to patient explaining what they have paid. स्क्रीन के राइट साइड में एक ट्रायंगल स्ट्रक्चर बना हुआ है. ये आपको यूएस हेल्थ केयर को समझने में आपकी हेल्प करेगा. इन द लास्ट स्लाइड वी अंडरस्टूड द बेसिक हेल्थ केयर स्ट्रक्चर. नाउ लेट्स लर्न अबाउट सम टर्मिनोलॉजीज यूज्ड इन यूएस हेल्थ केयर. अगर आपको यूएस हेल्थ केयर को समझना है देन यू मस्ट हैव नॉलेज अबाउट द बेसिक टर्मिनोलॉजी यूज्ड हियर. आप तभी यूएस हेल्थ केयर को अच्छे से समझ पाओगे. एंड इन दिस स्लाइड वी आर गोइंग टू डिस्कस अबाउट इट. सो द फर्स्ट टर्म इज हॉस्पिटल. नॉर्मली हॉस्पिटल को फैसिलिटी बोला जाता है. क्लिनिक्स दे आर कॉल्ड नॉन फैसिलिटी. डॉक्टर्स those are called providers. इंश्योरेंस कंपनी पेयर एंड ट्रीटमेंट जो हम इलाज करवाते हैं हॉस्पिटल से, दैट वर्ड इज यूज्ड एज सर्विस और प्रोसीजर. डिजीज को डायग्नोसिस बोलते हैं या डीएक्स बोलते हैं. बिल नॉर्मली जो बिल बनता है उसको क्लेम बोला जाता है. रिजेक्शंस जो क्लेम पे पेमेंट नहीं आती है उनको denials बोलते हैं, that is denial. So these are some terminologies which we have used here. There are some others. I will give you link in description. You must go there and check it. Revenue cycle management. Revenue cycle management different parts में divide है और हम हर एक part को एक एक करके explain करेंगे, एक एक करके समझेंगे. First of all, let's start from patient registration. Before getting actual treatment, patient is being registered and that is through registration process where all detail of patient is being filled. Next is medical transcription. This is the conversation between patient and doctor which is being recorded, and then later on that recording is converted into documents by medical transcriptors. Those documents are called medical records. Next is medical coding. The process of converting treatment or services which is given to patient into code is from medical coding. This is done by coders. Those codes are called CPTs. The next one is claim submission. When coding part is done, then it is required to put charges against those CPTs and that is done by a billing team. Next is account receivable and management. Sometimes insurance doesn't pay the expected amount on the claim. Insurance company pays less than expected. At that time, account receivable management team work on it, try to get the full payment on it. Denial management. Denial management team also works on the denials or rejections. Next is payment posting. The payment which is done by insurance company that need to post into the system, and that is being done by payment posting team. Next is patient billing. If there is a patient responsibility which insurance company has left, so that is billed to patient and patient pays on that claim, and that is done by um, patient billing team. And finally, performance and improvement report is being created. So this is the complete revenue cycle management in healthcare structure. CPT, current procedural terminology. We have learned in the last slide that CPT is a coding form of service or treatment. Here we will discuss more about CPT. Let's take an example that patient is spending 5 minutes with doctors. So here is the service given to the patient, and now if it need to be billed, so it cannot be billed like physician spend typically 5 minutes with patient, which is the complete description, but instead it should be in coding form, which is 99211, which has the same meaning uh, as its description in medical billing. Each service has different code to represent. राइट साइड में अगर आपको एक क्लेम की फॉर्म दिख रही है, सो वहाँ पर रेड कलर में ये क्लेम है और उसके ऊपर कोड दिया गया है. सो ये कोड बिल होगा इस पूरी की पूरी डिस्क्रिप्शन को एक्सप्लेन करते हुए. सो और इंश्योरेंस भी इसी सीपीटी के बिहाफ पे पेमेंट करेगी. There are so many CPDs, so those are categorized into 6 parts, 6 sections. First one is evaluation and management, that is also called ENM, and the range is 99202 to 99499. ऑफिस विजिट की जो CPDs हैं वो इसी रेंज में आती हैं. Anesthesia, the range is 00100 to 0199. जो इंजेक्शंस की CPTs होती हैं वो एनेस्थीसिया में आती हैं. सर्जरी, जिसको हम ऑपरेशन भी बोलते हैं, वो CPTs 10021 to 69990 मीन्स 1 to 6 की रेंज में जो CPTs होंगी वो सर्जरीज में आएंगी. रेडियोलॉजी प्रोसीजर्स, द रेंज इज 70010 to 79999. All those CPTs starting with 7, those are in radiology. रेडियोलॉजी में इमेजिंग के जो प्रोसीजर होते हैं, फॉर एग्जांपल एक्सरेज हो गया, वो रेडियोलॉजी में आता है. पैथोलॉजी एंड लेबोरेटरी प्रोसीजर्स, लैब की जो CPTs हैं, जो टेस्ट हैं लैब के, वो इस रेंज में आते हैं, विच इज़ 80047 to 89398. In medicine services and procedures, the range is 90281 to 99607. Diagnosis, the act of saying exactly what illness a person has or what the cause of problem is. पेशेंट को क्या डिजीज है वो एक्सप्लेन करने के लिए डायग्नोसिस कोड का यूज़ किया जाता है. Let's take an example. A patient is visiting to doctor and patient has a headache. So now instead of putting directly headache on the claim, we put R51, which is representing the headache. So this is the diagnosis code, and each diagnosis is represented with different DX code. I will share a link in the description. You can go and check more about it. Insurance sequence. Patient can have more than one insurance. So the first insurance, that is called primary, second one is called secondary insurance, and the third called tertiary. Primary insurance take the majority portion of the bill, and the patient responsibility which is left by primary insurance that goes to secondary, and the secondary responsibility goes to tertiary. एक एग्जांपल के तौर पर इसको समझते हैं. एक पेशेंट विजिट करता है हॉस्पिटल को एंड ही टेक द सर्विसेज एंड देयर इज अ $100 बिल. तो वो $100 बिल प्राइमरी इंश्योरेंस को जाएगा, और पेशेंट के पास जस्ट सपोज 2 इंश्योरेंस है, UHC एंड BCS. तो हॉस्पिटल ने पेशेंट के बिहाफ पे $100 UHC को बिल किया, and here insurance paid $80 and left $20 to the patient responsibility. In this case, if patient doesn't have secondary insurance, तो ये $20 सीधा patient को बिल हो जाएगा और patient पे करेगा. However, here patient has secondary insurance which is VCBS. So now instead of billing this $20 to directly patient, now hospital will bill this $20 to secondary insurance. This $20 goes to BCBS. Now BCBS paid $15 and still there is a $5 responsibility left. तो अब ये $5 पेशेंट को बिल होंगे और ये पेशेंट पे करेगा क्योंकि पेशेंट के पास सिर्फ दो इंश्योरेंस थी, UHC and BCBS. Let's assume if patient has three insurance, there is a tertiary insurance. Now instead of billing this $5 to patient, this will go to tertiary insurance. So this is how insurance structure work. Here we will discuss about COB and EOB. In the last slide, we have learned about insurance sequence. So that insurance sequence is being defined by coordination of benefit. This is the patient document. Patient will update insurance company that patient has any prior insurance or not. जब भी patient policy लेगा, that patient has to tell insurance company that he doesn't have any primary insurance. If he does have, he have to show to the insurance company. And similarly, when patient visit to the hospital, patient has to provide the primary, secondary and tertiary insurance sequence, and that document is called coordination of benefit. So this is the patient document, and patient provide this document to insurance company and to the hospital. The next is EOB, explanation of benefit. In the very first slide, we have learned that when insurance company pays, it send a payment detail to hospital and patient. That payment detail, that document, that is called EOB, explanation of benefits. So this document explain all the benefits which is paid by insurance company, and that is sent to one copy to patient and another copy to hospital. Next is standard patient types. Some standard patient types are emergency, inpatient, outpatient and surgery. Emergency, that is the category when patient comes to take the immediate services. Inpatient and outpatient. So whenever patient stays in hospital less than 24 hours, it comes under outpatient category, and when more than 24 hours, in inpatient category. And when the patient comes and take the surgery on the same day, that is the surgery, which stands for S. So here the emergency for E, inpatient I, outpatient O, and surgery S. Thank you.